I thought I'd show this just for fun. Have you guys all seen this before? Have you shown this? So in Europe, they do this quite a bit, right? And in South America. So that's the lift and drop technique.
My name is Mark Lafave. I'm a professor in the athletic therapy program, and athletic therapists primarily look at musculoskeletal injuries, and we deal with those from a clinical perspective. So when people get hurt in sports or various activities, we take care of those injuries, and so I help teach some of those things and also do research in it.
I want everyone to be able to touch each one of these, practice doing this. Sounds stupid, right? Practice it though.
Well, back in 1995, just after I moved here to Calgary, we started collecting injury information about various rodeo contestants. And so we published a paper that was a landmark paper in 1996 after we collected that data. First ever information that we collected on rodeo injuries in the world, really. It was done collaboratively with myself, Dale, and Dexter Nelson. And so in the end, we found out a lot about injuries, what was happening, and then ultimately what we wanted to do to help prevent those injuries.
And now how does it feel?
It's a little tender, but
Feels better.
yeah.
Yeah. It subluxed your thumb.
What's that?
It kind of popped out a little
Oh,
bit.
really?
And I was just testing it and it went back into place.
Oh.
We gathered a lot of data out of that, and so it identified three main problem areas: concussion, knee injuries, and shoulder injuries. So we looked at the mechanism of injury, and once we identified the mechanism of injury, then we wanted to go on and do different preventative measures like helmets as an example. And so one of the things that came out of that was a position paper where we said that young youth would have to wear helmets.
Where are you most sore now?
We'll just pull it
Right here is where
And thumb as well? Okay, ever hurt that thumb before?
No, I don't think so. I don't know, that hurt when it happened.
In 2004, we implemented that rule. We helped the rodeo community implement that rule where youth started to use helmets, mandatory use of helmets, and because of the mandatory use of helmets, they grew up using helmets, and then it just becomes second nature when they became adults. They didn't want to take them off.
Okay, slide legs up this way, head down there. Have you done this before?
Yeah. Well, it's for us, anytime you have an injury, they know so much about rodeo and rodeo injuries and how specific they are that it's way better than just going to a normal doctor because they're not familiar with what we go through and different motions that we use versus pretty much any other sport. So if we get hurt, they're going to give us a way more informed opinion than most people.
Just try to relax your hamstrings for a bit, okay?
Yep. That doesn't hurt too bad to do that. Yeah.
That bothers you when I do that? In the back again?
Mm-hmm.
Yeah. And what have you done to this one? Just so I have a good
Meniscus, same deal, but it's been a while.
And PCL, MCL, nothing else?
I don't know. I've heard them both, but I can't remember.
Yeah, okay.
In Chet's example, he tore his PCL last night down south, and so he wants to ride today in the Calgary Stampede. And most other people, that wouldn't even be a consideration. They would take time off, they would see somebody else, they would let it heal, they'd do rehab, and they make their own medical decisions, and so we try to help them make those best medical decisions.
That's too windshield.
That's not too tight anymore.
We were at a rodeo and a young lady's horse fell down. It was pouring rain all day long and the horse slipped and fell on top of her and broke her pelvis.
When the horse fell on her, she got pushed into the mud deeply, and so we had to find a way, and we knew that she had broken her pelvis based on our assessment. So we had to find a way to get her out of the mud.
She wouldn't let anyone touch her. She just screamed in pain. So Mark and I chatted for a quick second, and he convinced them that we could do it in a very novel, different way with different equipment.
At the time, scoop stretchers, they obviously existed because we had one in our unit. but they weren't used as commonly, and they certainly weren't used for hip fractures. People often at the time wanted to use flat structures just in case they had a spinal injury. We know now, because of a lot of research, that spinal injuries are less common, and so that the scoop stretcher actually becomes more important. We didn't know that then. But the other part was the scoop was able to go into the mud, deep into the mud, like digging like a backhoe almost, and be able to scoop the young lady and be able to lift her out of the mud because she was actually stuck in the mud.
We were able to keep her totally comfortable, split this stretcher in half and slide it underneath her, and that's not the normal protocol for a condition like that.
Okay, so you guys will be all the hardboard, and then you guys are the scoops.
I think research in general, what you ever hope to achieve is that you make a difference in the way we change the way we do things. And that takes a long time. So I'll use Dale Butterwick as an example. It took Dale 30 years to collect data on injuries, to evaluate that data, to create an intervention that might actually change the outcome of injury, and then assess it again. So that whole cycle takes an entire career. And so you hope to just make a little bit of a dent, honestly, in the overall cycle. So if you can make a little bit of change in terms of the way people do things, so that way they can participate in sport more appropriately, then I think that's all you can ask for in research.